evening to everyone. The joys of being online worldwide. And welcome to this webinar this afternoon, our end, to talk a bit more about the people-centered framework. We've got the great pleasure today to introduce you some of the results of our work, especially the Knowledge Hub and the Analytic Dashboard reveal. So I hope we're going to have an interesting time all together. The webinar will take approximately 1.5 hours, but we're hoping to spend quite a bit of that time in being able to do some question and answers. As always, just let's start with some housekeeping. This webinar is recorded for the benefits of those who cannot join us today because of the time difference or other previous engagements or holidays. We will take your participation as a consent to be recorded. Due to the size of the webinar, cameras and microphones were disabled for all but the panelists, but we monitor the chat for questions and comments, so please keep them coming. Please introduce yourself if you like in the chat. Give your name, your position, your organization, and maybe your email address so that we can stay in touch. Because a lot of people have signed up, but not everybody might make it. It's nice to know who's here today. We will have a question and answer session, as I said, at the end. Can you please type your questions and comments into the Q&A box and not the chat? So leave the chat for comments, use the Q&A box for question and answers, then it's easier for us to process them. When you put them down, please be brief so that we can actually address as many as possible. If you have something that is a bit more extensive or you have additional comments, recommendations and inputs, or something that we don't get around to say today, but you think about after the webinar, please contact us through the contact details, which we will share at the end. Our agenda, as I said, is 90 minutes. We're going to talk a little bit about how we got here. We want to talk to you about our user-centered research process and the things that it has highlighted. We're going to introduce to you the patient-centered framework Knowledge Hub, and then the analytics dashboard. Talk a little bit about next steps, and then, as I say, we go into question and answers. And you can see at the bottom of this slide, just the 4 of us who are here to talk to you today. So without further ado, let's get into the how did we get here. Now, I think we all can agree that we're a long way from reaching the NTB targets, and some might say that they're moving steadily out of reach, even more so since the COVID-19 pandemic, and NTPs are chronically under-resourced and ill-equipped, both in capacity and infrastructure to generate and utilize country evidence for responsive programming. And as I said, even more so since COVID. Now, on the plus side, substantial investments have been made over the last decade or so, ensuring more data, information, and knowledge are available than ever before. And one of the good things coming out of the COVID pandemic is that it has transformed health information systems and surveillance in general. We have new technologies, drugs and approaches, and we have more partners and stakeholders interested and engaged in TB than ever before. Now, we see the PCF approach as the new model for strategic TB programming worldwide. It provides a much needed structure for a systematic, holistic, and participatory approach to evidence-based programming. It allows NTPs and their partners, and this includes first and foremost the affected populations themselves, to develop people-centered, optimized, responsive, resilient, and evidence-based strategies. Now, we are hoping to move TB programming to the 21st century, shifting from the traditional clinical top-down model to a people-centered and human rights-based approach, in line with all the 3 pillars of the NTB strategy. So far, our work has mainly focused on application of the PCF approach during NSP development processes. This was done in close collaboration with our WHO colleagues, who are currently finalizing the revised guidance on NSP development. So we will only focus on the PCF specific components here, the steps shaded in purple in this graph. The first step after the usual planning the roadmap, the planning roadmap development is the data consolidation, which collates and analyzes all available and relevant evidence along the TB care continuum to identify program gaps, challenges and barriers preventing affected populations from accessing the right services and support at the right time. A big change is the shift to focus on prevention and what happens prior to clients' entry to the health services, which previously was often really neglected or not enough data available. We've also added much more attention to capturing the perspectives and experiences of the affected populations, so their preferences, customs, barriers, discrimination, stigma, human rights issues they might face. They're listed here as people-centered data. And finally, system-related data, looking at the wider health system, services, networks, infrastructure, social protection, etc. TB services are embedded in or linked to. The findings are brought in an accessible format into participatory consultative workshops at national and subnational level, where the evidence will guide problem prioritization, root cause analysis, intervention identification, and ultimately guiding the prioritization and optimization work that needs to happen before the NSP development. Now, we haven't invented the PCF. I just want to put that up, but we've built on the experiences of some pilots that have been applied, the PCF framework in different countries for different purposes. So there was grant portfolio optimization, countries have used it for national planning, TA optimization, and one country did a full NSP development. And we learned from them and we talked to them and they guided us when we started working with other countries. Now, we supported 10 countries during the last NSP development and Global Fund grant application cycle, and then refined, customized, and worked on the process with the countries and the tools according to country needs and feedback. We co-created and developed some new tools as well with some of the early adopter countries, but more about that later. We evaluated our experiences in collaboration with the early adopter countries, partner organizations, donors, and other key stakeholders. And today's meeting will focus on sharing some of the resulting developments. At the end, we will share with you issues identified as outstanding, as well as some ideas on where to go next. Now, here's some of the feedback that we've received from the partners and the countries, which for us sort of built the framework of the development. And we took great care to listen to everyone who has got a stake in this. And that is mainly the countries, but also obviously the partners and the donors they're working with. The feedback was that it provided a really good structure and it helped countries to sort of systematically analyze their data. Patient perspectives and stories of access barriers have all been taken into account. We had partners saying that they finally understood what the TB program is all about and how it works and what it means and how they could be involved. I mean, that's from someone who doesn't actually traditionally participate. It helped countries to think beyond what they were doing, where patients were missing and where they were seeking care. They learned to need the services, bring the services closer to the patients. They focused on specific issues and aligned the broader health to the broader health system, and they realized that they could actually influence the whole system and not just TB. And lastly, we also learned the things that we can improve, like the suggestion that we should really think about a concept that helps to include more sustainability and value for money decisions and considerations. This is just a snapshot of all the things that we faced during the implementation, some of which we have been able to address, some of which are still to be solved, and some we might have to learn to live with. But more details now from Eguma. Eguma, over to you.
Thanks, Kathy. I'm requesting control of the slides.
Go for it.
Perfect. Thank you. Oops. doesn't seem to work.
Oops, sorry.
It does say I can control your screen, so it's weird.
Can you do it now?
No, not working.
Why don't you share your screen?
I'm just going to share my screen. Perfect.
Okay.
So my name is Eguma Efo, and I'll be presenting on the user-centered design and research process. First, the aim of the user-centered design process was for us to identify what people consider to be the biggest challenge that they experienced during the first implementation of the PCF process. Secondly, we wanted to ensure that the outputs of the research actually informed the tools being developed. Based on this, the main user design principles we focused on were efficient tool development. Given that it is more difficult to iterate on solutions later in the process, when they are more developed, this user-led research and design process allowed us to come up with validated ideas early on the development cycle. Secondly, the process then ensured that we discussed with the actual end users of the tools that we were working on. This forced us to be clear about who our intended end users of the tools are. By thinking about the problem spaces for the PCF holistically, the user-centered process ensured that solutions we developed are cohesive and work well together. Finally, and most importantly, this process ensured that all the voices were heard. That is, the end users of the tool speak to the current challenges that they experienced and contribute to the solutions that we developed along the way. As much as was possible, given the COVID-19 impact and working virtually, we tried as much as we could to incorporate perspectives from all stakeholders during this process. And the timeline you're going to see on this slide will show you the stakeholders we engaged during the different phases of the development cycle. So during the problem identification phase, we first of all collated information from the PCF evaluation process. We'll remember that meeting that happened in January, and we were able to collect the feedback from that meeting. We also conducted in-depth reviews of existing TB data systems in 4 countries: Ethiopia, Rwanda, Uganda, and Zambia. Additionally, we had sessions with different global partners to gather insights into the challenges and opportunities of existing country systems, because we wanted to make sure that any resources that we built fits in with the existing systems as much as was possible. During the solution prioritization phase, we worked to incorporate guidance and feedback from the different stakeholders, making sure we were prioritizing feedback from our country partners as we designed the potential solutions. And finally, we developed the tool mockup with the prioritized features and shared this with the initial 4 countries we were working with, in addition to Nigeria, who joined us at the later phase of the project. The final PCF tool, which is a PCF DHIS2 dashboard, is what will be presented by Mike in the next session. But before we do that, let's talk a little bit about some of the challenges that we saw and how we prioritized them during this process. So the priority features that we saw for the PCF will be the, one second, I think I've moved things around. Yeah, so the prioritized features in the PCF dashboard included linking the dashboard with existing systems. For example, where the dashboard is auto-populated from WHO TB dashboard, where a country has already installed this system. Simple mapping of indicators will be required to be able to complete this. Based on DHIS2 features, data entry can be done offline, and we included very easy to interpret visuals along the care cascade. The dashboard can also be used at the national and or sub-national levels, allowing countries to map the data along their existing organizational units in the HIS2. Data can be easily imported or exported into the system, into the dashboard. And where countries see that the indicators need to be edited or they need to add indicators to provide better context for the system, this can easily be done. So all of these features were prioritized based on the feedback we received from the countries and the stakeholders during the process for the development of the dashboard. As a whole, we received a ton of information from the review of the PCF process as a whole, not just the dashboard. And what the slide shows is just a collation of the information. As a note, this information will be detailed in a report and shared with people who are interested in seeing more details on the findings. For now, we'll focus a little bit more on the high-level categorization of the feedback into themes. And some of the themes we saw as we dug deeper into the challenges were challenges around PCF core team and stakeholders, challenges around data, resources, and modeling. Some of the main challenges we saw that were experienced by the PCF core team and the stakeholders were around the different levels of experience and knowledge of the PCF approach itself. The PCF timing we saw was not tightly aligned with the strategic planning timing. And in some cases, we saw that the strategic planning had already happened before the PCF process began, and this was not ideal. The work plan was not detailed enough to capture all the PCF activities, and this also distilled into the PCF roadmap that did not then match the PCF steps. When it comes to resources, I don't know if this is blocking my screen, I'll put you guys down here. When it comes to resources, the general theme of challenges experienced for resources was basically insufficient resources, including time, funding, training. There was just not sufficient time to conduct the process in some countries, not enough time to train people on the use of the tools. There was issues with language where, for example, English was not the first language spoken and they had to break out into teams. Budgets were not typically very well developed to cover all the activities. Around data, challenges experienced were largely around just lack of appropriate data tools to make the data consolidation process more efficient. So although there was a tool, this tool was developed during the PCF process and feedback was collected from users of the tool, and the tool was trying to be improved, but it wasn't very efficient, and people struggled with the use of the tool. Again, they found out that they needed something that was more flexible to just support them through the data entry and data consolidation, because it was a very tedious process to do that manually. And finally, around modeling, there was just general lack of expertise and knowledge within the team to do modeling as a whole. Where expertise was available, modeling was done late in the process. And in general, there was no standard approach to modeling. Based on these challenges that we identified, we then focused on identifying solutions to address challenges we had found. And priority solutions were designed as part of the PCF Knowledge Hub, which we'll be revealing a little bit later in the session. Some of the solutions we looked at were prioritized to improve resources, including a handbook with step-by-step instructions, allowing consultants to prepare for the process. Predefined templates for work planning, roadmap developments, etc. A facilitator's manual with exercises for each step of the participatory process. Budget and planning tools for undertaking the PCF process, allowing users to indicate what resources were required even before the process started. And most essentially, information on realistic time investment for each step of the process, just giving that some of the processes took longer than time was allotted for. We'll also focused on solutions around prioritizing course modules for implementers. And this is around tailoring courses for different stakeholders, looking at advanced level, basic modules, different levels, just so that everybody that is on the team can be brought up to the same level of understanding of the PCF process. A learning platform that will allow participants to also train offline in situations where internet was going to be an issue. E-learning process with step-by-step instructions for beginners and advanced levels, again, to cater to different stakeholders within this process. Thirdly, we looked at issues around linking valuable tools and resources. And so we focused on shortcuts to additional information and resources that were also useful to the PCF process, but may not have been developed as part of the PCF process. A compendium of existing tools that users could have access to at different steps in the process, and also standardized tool overview and implementation guidance. For example, what is the tool? How easy is it to use? How long will it take to use that tool for the process? And just overview of information that users can get access to all in one place. Finally, we looked at, we're prioritizing a learning community. So a learning community will consist largely of country case studies on how process can be adapted, linking people with similar roles within the core team across different countries, and also sharing success stories of using the PCF in countries, because this can be very enabling for other countries who are just starting the process. Based on the priority features, a blueprint of the PCF Knowledge Hub was developed, as is shown here. And I'll just talk you very quickly through the blueprints before we show you a very short introduction video of the PCF Knowledge Hub. So as part of the PCF Knowledge Hub, we have a general introduction to the PCF approach for those who are new to the process. You'll find this in the About section. We also show the 10 countries where the PCF approach has been used and the different partners that have supported the PCF approach during this process. We have a PCF handbook that basically is the step-by-step implementation guides for key components of the PCF approach. So the PCF handbook provides necessary instructions, resources, tools, tips and tricks that will support countries who are implementing the PCF process. We also have a toolkit with diverse useful tools and templates which can be used during the implementation. So a core tool that was conceived as part of the PCF process is the PCF dashboard, and that tool can be found on the PCF Knowledge Hub. In addition to that tool, we have other tools that have been developed by different partners, and this Knowledge Hub will provide you links to the different partner pages that will give you access to those tools. We have a learning section that provides capacity development resources such as e-learning courses. Keep in mind that some of this work is work to be done, such as the e-learning courses, webinars, how-to videos, as well as experience sharing platforms. So either through case studies or country examples or experiences, there will be case studies and sharing done in that section. And finally, we have a resources section with global guidance from WHO, so including the NSP guidance and the one that is currently being developed, that will be included in the Knowledge Hub once it's ready, and publications on the use of the PCF approach, either by countries for different purposes. So I'll just play a short video on the introduction of the PCF Knowledge Hub, just to say that the video credit goes to my colleague, Rachel Powers.
Introducing the People-Centered Framework Knowledge Management Hub. First of all, what is the PCF? The People-Centered Framework approach for TB was developed to provide countries with a standardized and structured model approach to facilitate country-driven, people-centered, optimized, evidence-based TB programming. The goal of the PCF approach is to assist the national TB programs and their partners to critically analyze their respective programs using systematic methods based on the TB care continuum. The resulting findings should inform improvements in TB prevention and care. The TB care continuum, also called the patient pathway, follows the patient's journey from being at risk but healthy, then through infection, symptom development, and seeking care. Next comes their entry into the health system, diagnosis, treatment, monitoring and support, and professional care until cure. Traditionally, TB programming has focused primarily on epidemiological data for program evaluation and planning. The PCF approach collects and consolidates 3 types of data. These are analyzed along the care pathway and form the basis for program evaluation and analysis. The findings are visualized and utilized in stakeholder consultations to identify priority problems, perform a root cause analysis, and subsequently develop and prioritize interventions to solve them. The PCF approach can be used for program planning across the board, from national strategic planning to grant portfolio optimization and technical assistance harmonization. Especially important today, it can also be used for emergency mitigation planning, helping address the impact of challenges like COVID-19 on TB programs. The PCF Knowledge Management Hub was conceived as the one-stop shop for a PCF community of practice. It was designed to host all relevant resources, tools, learning, exchange, and interactions, as well as links to relevant additional information and resources needed for the successful implementation of the PCF approach. The PCF was jointly developed by partners and refined by the KNCV Tuberculosis Foundation with input from 10 early adopter countries. Working together, these tools and processes were tailored to country needs and actively co-designed and created in a community of practice. You can find these specialized resources and tools on the PCF Knowledge Management Hub website. Make sure to check out the PCF Handbook for guiding design, planning, and implementation of the approach, the Toolkit for purpose-built templates, dashboards, and wizards, and the Learning Area to dig into relevant case studies, how-to videos, webinars, forums, and e-courses. All these and more are live now at www.pcf4tb.org. Come have a visit.
So please feel free to have a visit after the webinar. I'll hand this over to Mike. I think it's better if you share your screen, Mike.
Great, let me do a screen share. And we'll jump in. So thanks, Fikuma and Kathy, for that helpful introduction and overview of some of the other tools of the PCF. So I'm going to do just a quick run through of the PCF dashboard. And I'm part of a team, Linksbridge, that has been working closely with KNCV to develop some of these resources for the PCF and think through sort of how we want to develop tools and respond to some of the user-centered research that Aguma had walked through. So we're going to do just a quick overview of the PCF dashboard, what it used to look like, what it sort of looks like now. We'll have a short video as well about that'll do a demo of the dashboard, and then talk a little bit about some of the features and what's next with the dashboard. So I think folks who have participated in the PCF prior to these new resources are probably familiar with some of the data consolidation and data analytics tools that were available in early versions of the dashboard. The tools that existed before were Excel and Tableau based tools where users would go in and enter data in Excel form. Some of that data would get visualized in Tableau, and that was used as part of the PCF process early on. However, as we talked to folks and gathered some of the research about what worked and didn't work well in that first phase, it was clear that there were some challenges with this approach. So I think, first of all, having two different tools that could talk to each other but weren't necessarily built to talk to each other was a challenge. And so we really wanted to think about how to have a more integrated system. Some of these tools were hosted by external partners. And so some of the research that we heard was that we wanted to make sure that this lived on country systems. This was owned and administered by country programs, not hosted externally anywhere. There was sort of a multi-step process to update between the Excel tool and the visualization tool. And we wanted to think about something that would be a little bit more automated than what was currently available. And then I think the last piece that Administration of users by the NTP was cumbersome. It wasn't necessarily managed entirely by the NTP. So we wanted to, build a solution that responded to that made it really easy for the NTP to control who could have access, who could see the data, who could share the data, who could change the data, et cetera. So that's kind of the system that we came from and a lot of the feedback that we got about the system. As we then went into tool and solution development, and Aguma touched on this a little bit earlier, we started to explore what a new system would look like and have had a couple conversations about what those solutions are. And so what the new version captures and focuses on are a couple of core features. And this page highlights at a high level some of those features that were important to get incorporated. And then the demo will go in and actually show what some of these features look like in action and in execution. So I think at a high level, what we wanted to make sure was, like I said, this is an all-in-one solution. So the tool is built in DHIS2, the data entry is available in DHIS2, it's directly connected to visualizations in DHIS2, and the entire system can be installed and run on existing country programs within DHIS2. Countries can also customize and develop their own visualizations so that they have the ability to change visuals, et cetera, as they see fit. And then I think finally, this is a system that, as we'll talk about in more detail in a second, countries can install on their systems. They own who runs it. They own who manages it. They own the data that goes in. They own the data that goes out. They own who has access to different aspects of this. So by building this in DHIS2, a system that folks are already familiar with, we were able to capture some of these new features that really, I think, responded to much of the feedback that we heard from folks as we were going through this process. So with that, we'll jump into a video with a deeper dive demo of some of the features of the PCF dashboard.
So let's jump into a quick demo of the PCF dashboard platform. If you want to, you can sign in. There's a demo account. We'll provide some links at the end of the workshop to allow folks to sign in and explore this demo on their own. But let's just jump in and we'll do a quick tour of some of the core features of the dashboard platform. So once you sign in, you'll be taken to the actual dashboards themselves. There are three, I think, main points of interest that folks will be using most regularly as part of the PCF, which I'll do a quick walkthrough here. We also, for those who want to dive in more detail, we'll provide a lot more documentation, background. There's a longer training video that will be available on the PCF website, but we'll just do a quick tour of some of the core features here. So what we're seeing here is the dashboard that contains all of the core PCF visuals. We've selected some default visuals to be the sort of landing place and the main part of the PCF dashboard. However, as we'll talk about in a second, these visuals are customizable and can be changed in ways that people want to be able to display visuals in other ways. They can certainly do that as well. But just a quick tour. I think the main applications that I think are important to understand about the DHIS2, the dashboard platform, are the data entry form. So this data entry icon here, the dashboard, which is the page we're on now, and then the data visualizer, which allows folks to create or edit any of these custom visuals that exist on the dashboards themselves. So we're going to start with the data entry, as that's sort of the first starting point for folks using this platform. Then we'll talk a little bit about the dashboard, and then we'll finish with the data visualizer and just some of the customization that's possible through that. So the first place that we want to talk through is just this data entry form. And this data entry form is really intended to replace the Excel data consolidation tool that we used in the previous version of these tools. And it has all of those indicators available in DHIS2 in this data entry form. So right now, the geographic scope of the default data entry form is global, or sort of a top level unit. If countries are using this, there is an ability to customize these geographic units and enable people to show subnational So if you want to show regional data or enter regional data, enter district data, folks can do that as well. So you can see there's sort of the core PCF steps as part of the data entry form. So people not accessing the health system, people seeking care but not diagnosed or notified, or people diagnosed and notified but not necessarily successfully treated. We've got UNHLM targets and achievements, and then a general TB profile. And if you click on any one of these and select the period, what you're going to get is a long list of the indicators, again, that match the Excel tool that was used previously. Folks can go in and enter the absolute values, upper limits, lower limits, and then each of the indicators have a version of disaggregation that's relevant to that indicator. And these all save as you go along. So folks are entering these and they need to set it aside for a second and then hand it off to a team member. That saves as you go along, and it will stay within the system once you've installed it on your own system. So there's indicators for epidemiology, there's people indicators that match the sort of previous PCF indicators, there's system indicators, and folks can go in and enter all of these indicators here, enter the data, and that will help populate the visuals that show up in the dashboard itself. So then jumping over to the dashboard, sort of back to the landing page where we started, there are then similar to what existed in the Tableau version of the dashboards, there are sort of dashboard sections for CC1, which we talked about, people not accessing the health system, CC2, CC3. There are also a couple more dashboards for UNHLM targets and achievements, and then sort of core PPA visuals. So these visuals are built in, these dashboards are built into the package that folks can install in their system. And these will be sort of the default visuals as people log into the system and look at what's available. A few things that I think are useful to note is, so you can see which, as you're hovering over these, you can see which indicators these tie to. So you can see this ties to EPI 1.4. So if you're ever looking at the visuals in the dashboard and want to go back and you see some data that's maybe incorrect, you want to go back to the data entry form and change that data, you can just kind of hover over, or sometimes it's in the legend itself, the indicator, and go back to that indicator and change whatever information you need to change there. So again, there's visuals available for a number of indicators across CC1, CC2, CC3, the UNHLM targets. There's dashboards for each one of these, and they're sort of standard, but folks can certainly go in and build and customize and change things as they see fit. A couple other things that I think are useful to highlight for the dashboard platform and the system within DHIS2. So we'll go back to the CC1. Two things to note. One, this little ellipsis in the upper right-hand corner shows two important features, I think. One is the ability to show interpretations and details. And really what this is it opens up a menu to have a conversation. So obviously a core part of the PCF is the sort of workshops and the review of all the data among core stakeholders for the PCF. And I think what this enables is folks to actually have some of that conversation about the data and about the visuals asynchronously. So maybe I want to write an interpretation of this visual, and then a colleague of mine wants to respond to that interpretation or add some more context to that. You can do all of that within the platform here itself, and sort of have that conversation ongoing within the platform about any of these visuals. So you can turn those on, turn those off, show and hide those, and that's sort of available for folks as they're reviewing and working through the dashboard as a team. And then I think the last thing that we just want to highlight is the ability to change any of the visuals. So again, we put some default visuals in here, knowing that we're not going to be able to anticipate all of the ways that people want to visualize their data, all of the ways that people want to tell stories with their data. And so there is the features built into DHIS2 to be able to go in and edit these visuals. So if you click on the ellipsis, again, that you can open up the data visualizer app, and that will take that specific visual and give some more customization and ability to change that visual in whichever way you see fit. So you could change the data that's included in there. You could change, maybe you only want to show 3 of the 5 years or 2 of the 5 years. So you can change some of the filtering on there. Once there are more geographies included, you can make sure that this shows only one district or maybe a handful of districts rather than the entire country. So you can do some filtering and adjusting of the visual that way. I think the other thing that's useful to note is if you want to actually change the style of the visual. So right now this is a column chart. You can change this to a line chart, click update. Once that's updated, you can go back then to the visuals. Save that, go back to the visuals, and then once we refresh this dashboard, that visual should have changed to a line chart, and off you go. The dashboard is updated with those changes. So that's just a quick run through of some of the key features of the dashboard platform. Like I said, we'll talk. There's a lot more detail on the PCF website. There's more documentation. There's a longer sort of training and walkthrough video available. So if folks want to go read that, that's available. And also I would encourage you to log in, use the demo login information, and explore the dashboard platform a little bit more yourself. So I think that we'll finish there with the demo, and so let's jump into a.
So let's move to the next couple features that we just wanted to touch on with the demo. And again, I would encourage folks to go log in, take a look around, and review the dashboard in a little bit more detail. The next big thing that we just wanted to touch on and focus on is the fact that this is being published and being shared as a DHIS2 metadata package. And we won't get into the details of that here, but essentially what that means is that if I'm a country or if I'm a program that's already running a DHIS2 platform, I can download this metadata package, install it on my DHIS2 system, and all of the data entry forms, all of the visualizations will be pre-built and ready to go on your system to use for the PCF. So for those who are familiar with DHIS2, you may have used metadata packages before, but this was really, I think, an important priority for us as we were responding to some of the challenges in building out a solution, was the ability for countries to own and run this on their own systems without need for external support or external systems, and have it run on their own DHIS2 platforms. And then lastly, what we just wanted to talk about was sort of where we are today, and then some of the potential next steps that I know we've talked with many folks on the call about, and where we think this could potentially go. So right now, the DHIS2 system is the place where the PCF data entry exists, the PCF data visuals exist. It has the ability to sit on country systems, as I mentioned. I think Aguma also highlighted that this has the ability to connect to the WHO TB metadata package, where folks already have that installed on their DHIS2 system. So where there's an existing linkage there, the new PCF metadata package can pull in data from existing systems. And so really this is just to start to replicate the data consolidation process that we had before and make that easier for countries to execute. What we're envisioning and what we've had some conversations about moving forward, and this will be, I think, conversations about next steps and opportunities to further develop this, is really, are there areas where other data systems, other partner systems, other partner tools could be connected directly to this PCF data platform, so that it saves countries time for pulling data out of tools like the PPA or pulling data out of tools like the WHO database, et cetera. We know there's a lot of folks working on data tools. So we're imagining that there might be some opportunity for future integrations with those tools in other versions of the dashboard platform. But I think that's sort of all we have for the dashboard now. Again, I would encourage you to go to the website, take a look around, provide comments and feedback. We'd welcome any insights that folks have. And with that, I think I'll pass it back to the team to close us out. Kathy, do you want me to just go to the discussion section or the next steps? Or do you want to do it?
Sorry, defeated by technology again. I couldn't find the unmute button. If you could actually first jump to the acknowledgements, please, because I think this is a great time to basically, I'm very, very proud to show you today all of these things that we've done as a team. But I mean, this work is really, really country driven. I mean, we had the fantastic opportunity to have a donor that was very encouraging for us to sort of go out there and do stuff and try and fail and make things better. So massive thanks to the Gates Foundation to actually really believe in us and help us do this. And a massive, massive thank you to the countries that worked with us on this, who took a step into the unknown and went wholeheartedly into applying these tools. And you can see the list of countries there. And have actually challenged us on so many levels to make better tools that are really, really respecting their needs and really responding to their needs and helping countries to plan better programs, implement better programs. Countries have been super in helping each other as well. There was a lot of interaction, and I think this is why we wanted the Knowledge Hub to happen, because we really see that as a community of practice, and all of you can make that same difference. You can all be part of this and really help us take these to the next level. So if you could go to the next steps, please. That's 2 slides up. Yeah, thank you very much. So the work isn't done, as we've said. We still have some work to do to finalize the toolkits and the handbooks and the Knowledge Hub even. We talked about the e-learning platform, certainly for the data consolidation and analysis. That was a request by countries to just really build more capacity all around. We want to create a user forum where people can talk directly to each other without having to involve us. So these things are on the cards for us at the minute for the next phase. We also want to pilot and release the PCF meta package, obviously, because at the moment the demo version is there. Now we need to see how it works with the integration into the DHIS systems in countries, and then for countries to really use that in their next planning cycle or program evaluation. We want to refine the approaches for prioritization and optimization, because that's something that has continued to be a bit elusive and a bit of a struggle, because modeling is obviously part of it, but there's a lot of other things for countries to consider. And we would really like to spark more consultation and discussion on the subject on how do we define allocative efficiency and effectiveness, and how can we prioritize when everything really needs to happen? How do we optimize? So we want to have more discussions, but we need all of your brains engaged in this process to help us really think this through. We also would like to apply the PCF process again with some more countries to see if the tools have improved the situation, what else is missing, what else could it be used for. So I think the options are limitless. Money is not, but I think if everybody joins in, we can do a lot. Now, my question to you before we go into questions and answers for you to us is, what else? What else could we do? And how else could we help countries and each other to improve the whole fight against TB worldwide? So I'm handing over to KJ for the question and answer session. The floor is open to you.
Great, thank you, everyone. I think this was really great to see the culmination of the work. And so we do have one question, and please continue to add questions to the Q&A, because this is your opportunity to ask the panelists, ask us all your burning questions. And then, of course, this is just the beginning. We're going to be available for ongoing conversations. So a question from Finn is interested in the proposal to integrate further data tools specifically for modeling. Do we see this as models producing standardized results, which can be included or model inputs coming out of the dashboard, or is it both? And I will let the panelists choose who's going to answer that.
I'm happy to answer it if you want. So thank you, Finn, for your question. So one of the major, as you saw, one of the challenges we saw that was highlighted by countries during the first PCF process was modeling. It just was a struggle for them to do any modeling at all. There's not a lot of expertise there. We do not have a clear answer to the how now. We do know it's definitely a problem, but the how of how that will be done is still something we need to do a little bit work on, which is why we have tried to kind of push it further down the line and not deal with it in this first phase. And it can be done from different approaches. We can look at an opportunity where countries have the right indicators that are collected on the data entry tool, and those indicators then help them to feed into some models. It could also be where the tool itself is supporting some modeling situation and then giving them some outputs that they can fine-tune using other modeling tools. So there are going to be several ways to do this, and we don't know which is the best way now. However, we are looking to talk with the expert modelers like yourself as we move forward to understand the process better. Now that we know what countries need, it'll be good to understand from the expert modelers how can we support the countries to actually build out a solution that will work for them. So definitely we'll be reaching out to some of you as we go forward with this.
Maybe just to add to that as well, I mean, the one thing where I also see the link is trying to then close the loop and not just have the information for the modeling, but then also the modeling inform what data needs are still there and what questions are unanswered. And I think that will overall improve the evidence that countries have available to really respond to their program needs. And also it will help to hopefully refine the amount of data that we're generating, because it's very tempting to generate a lot of data, but sometimes to overwhelm the system. So the more we close that loop on the questions that need to be answered, and everybody gets their information in a centralized manner and in a coordinated manner, it should actually lighten the load, hopefully, all around.
Great. Thank you, Kathy and Aguma. And just a note to those that are raising their hands, could you please use the Q&A section, because we actually we're unable to unmute participants. So this is the only way for you to ask your questions. So our next question, I'm guessing we'll go to you, Mike, is from Christina, asking about, in addition to the databases mentioned, such as WHO, is it possible for countries to upload their own or additional data sets to the dashboard as Excel or CSV files, so that the DHIS2 platform can sort through that, so the data can be analyzed? And if so, do the files need to be pre-formatted? Wondering if you could speak to that, Mike.
Yeah, thanks for the question, Christina. So right now, the aim is that folks can upload a whole bunch of different data sources. It's still, a lot of that will still need to be built out, but I don't think that we want to limit it to just the WHO data necessarily. We know, of course, that countries have a lot of their own different data sources and data systems. So we also want to build it such that countries can upload a standard Excel or a standard CSV that doesn't exist right this second. And I do think probably if there's a consistent format, it'll make things easier, as folks are probably familiar with. But that's probably a conversation worth having in sort of the next phase of this work, is how do we make it as easy and simple as possible for folks to upload some of those standard data sources that we know exist elsewhere. So that's a short answer to your question, and I think the longer answer is probably a follow-up conversation to just brainstorm a little bit what that needs to look like. And I don't know if Aguma, if you have anything you want to add to that.
Yeah, I actually wanted to add to that. Thanks for that, answer, Mike. Just to add that, so the DHIS2 metadata package works in any way, in the regular way the DHIS2 system works. And countries who have used the DHIS2 system will understand this very clearly. So if you have, for example, if you are adding new indicators to your data sets as an HMIS, what's that process you go through? You define your data sets, you map it to a code, and then you upload that data set. Same formats for this. If your country decides, oh, we need additional data sets, it will mean you need to define those data sets within DHIS2. You will need to map those codes to the dashboard indicators, and then you upload that, and that should automatically be able to sync your information. So for now, it works the same way with DHIS2. Definitely, there's a little bit more work that can be done in that direction.
Great question. And Anand has another really good question here. So for integrating with the country DHIS2, could it be possible that the variable names are going to be different in different countries, and how's that handled from country to country? And is it safe to assume that all variable names are going to be standardized?
I can answer that.
Great.
Thank you for that question, Anand. So yeah, variable names. So the way we've worked with this is, as for the PCF approach, we've come up with a standard set of what we call PCF indicators. And this PCF indicators map to that cascade of care that you saw Kathy show at the start of her presentation. People not entering the health system, in the health system, not being diagnosed, not successfully treated, all of that. And the idea is, if countries are able to collect data for those indicators, they are then able to visualize the gaps along that cascade of care. Now, what happens is the metadata package is not hosted on anybody's system. It's actually a package you take and then you attach it to your DHIS2 system. And while you're doing that process, the idea is that you then map your indicators to match whatever indicators we have defined in the metadata package. That way, your indicators then read those indicators and provide the information you need to see. So while they are standard indicators defined in the same way, the way you have defined it on your system may differ slightly, but as long as you map them, then it will read that information. And I hope that was not too technical. I hope that explained, answered the question.
Thanks, Aguma. Yeah, these are all really great questions diving into the nitty gritty here. This next question from Eric is, Eric's interested in knowing that the PCF is used at the subnational level and what changes can be gleaned from that compared to period before PCF was used.
Kathy, do you want to take that?
Yes, I'm just trying to get my head around the question, sorry. Well, the PCF was used, as far as I understand, before we got involved in Pakistan for subnational planning. I'm not quite sure how detailed the results then fed back into the national system. But I know that they've used it for, again, in questions of Global Fund programming optimization, as far as I know. The thing that we've realized with countries is that it's nice to do a strategy at a national level, but actually the implementation happens at subnational level. And especially for bigger countries, there is a lot of diversity of context situation, epidemiology, even cultural makeup in many countries. So the tools that we have will work either at national or at subnational level. We would like to try and actually do a bit of a two-way stream where we work at subnational level with the countries and the programs to really create good, solid understanding of what can be changed locally and then feed towards reaching the targets. And I think that's really what we need to try and achieve. In many countries, the planning process is so rushed that often there isn't enough time for consultation at subnational level. And because the data often gets basically fed upwards and then aggregated and aggregated. The level of detail and granularity that you need at subnational level to really make good plans is often lost. So these are all questions that we're still trying to answer, and we're trying to work out with really country perspectives. I know that some countries found some very elegant solutions. Kenya is one example. It took them quite a while to work on that, but they managed to do it both ways. Other countries struggled more. So I think that's all to be discussed and further explored in the next phase. Does that answer your question?
Yeah, and maybe, you know, the last part of this question is, you know, are we able to see any examples of impact of using this yet? And, you know, whether it's impact with a capital I or maybe lowercase I impact.
I mean, we're trying to establish that. And I mean, part of what we want to do in the next round is really to have a much more detailed midterm evaluation to see what has happened. Saying that, I mean, just in the conversation now, the Tanzania team has said, oh, the midterm evaluation is coming up and they would really like to use the tools and just see what happens. And hopefully that will inform us all in what's going on. As they say, the proof is in the pudding. Most countries have only just started to implement the next Global Fund funding round, but it would be very interesting to see what has worked well, where is information missing, and where we didn't get the granular detail. Comes back to Finn's question earlier as well, I guess, to really say, you know, what are the levels of data and how do we integrate and get that information all together? Maybe we'll leave it at that for now.
Great. Okay, so moving on to the next question. This might be to you, Mike, from Kristen. Any idea how many countries are using DHIS2 system? Maybe, I'm not sure if we know.
I actually
Actually, no. I have the information.
Okay, great.
I can break it down for you. 61 countries have done national implementation. Happy to share this with the map and all of that later. National implementation is 61 countries. Of those 61 countries, 53 of them have case-based level in, implementations. 12 countries have done like a pilot kind of implementation. And then when we talk of the WHO TB dashboard that we're referring to earlier, we have 24 countries who have actually installed that package.
Great. I'm not going to presume who's going to answer the questions moving forward. So our next question from Stephen is, how is DQA, data quality assessment, integrated in the tool? For example, is the tool able to detect data that might be outliers and need attention?
Thinking about the answer to that now. So
oh, go ahead, Nkuma, if you have.
Go ahead, Mike.
I was going to say there's probably a two-part answer to that, Stephen. The first part is right now in the tool, there are some very, very, very basic, we'll call them validation rules that just make sure that, you know, if we're asking for a percentage and somebody puts in there 180%, there's sort of a flag that pops up that says, hey, this doesn't quite fit the rules that we were expecting. You should take a look at this point of data. I will say that they are not the most, you know, sophisticated rules. We're kind of right now just checking for a lot of the basics to make sure that data is entered is relatively clean and ready to go. I think that's absolutely an opportunity where there could be more validation and there could be more like sort of quality assessment built in. And so if that's something that you're working on, or, you know, others are working on, that there could be something adapted into the tool, we'd certainly love to take a look. And I think there's the ability to add more validation rules in there. We've just done sort of a baseline level of validation to include to start and welcome ideas for future features. So
can I add to that, please?
Yep.
That's obviously the system side of things, but the one thing about the PCF that this is all about. I mean, the tools are tools to help us all having those discussions. And I think what we're really trying to do in the workshops as well is basically for all the participants, and that's not just the techies amongst us, to then sit down and say, does that data make sense? Is there anything missing? Because your data is only as good as the entry, and your data is only as good as the data that is available. But there's a lot of things happening that might not be captured in the initial data entry. And we've seen that in some of the countries where some participants in workshops had data and information from their background of work that weren't available to the TB program, but they have been able to then say, oh, but we've got a survey that has just answered these questions, or we have a database that deals with the granular details of community work. And that's what we're trying to bring together. So a lot of the quality assurance, there's obviously the checks and balances, but then there's also bringing all the partners together with their own expertise and saying, does that make sense? Is there something really weird about it? Is there something that we need to look into? And I think all of that debate will hopefully guide how data systems and the way we deal with data will be improved over time. This is specifically important for areas where we might actually have discordant data, where one survey says one thing and another survey says something else. And you know, some of that is bad luck. But it's just good to find out really what's happening and what is the agreement that we all come to that we will work with, because we need to make a decision at some point. I hope that answers your questions on both sides. Thank you.
Great. Thank you, Kathy. So the next question we have is, what is the source of data to obtain people with symptomatic disease not seeking care and people with TB seeking care that have not been diagnosed?
So we did some data mapping, I would say kind of early on in the process. We do need to do another version of it. We're working with countries. We did some data mapping, and what we found out was for people with symptomatic disease not seeking care, you typically can get data from prevalence surveys. For the PCF process, we do advise that prevalence surveys should not be older than 5 years, just so the data is relevant. And then for people with TB seeking care but not diagnosed, I mean, there are several options. You could be looking at your surveillance data within your HMIS. You could also be looking at prevalence surveys. And sometimes the global TB database can be a huge resource. But these are not exhaustive.
And not to forget inventory studies and local studies that might have happened where people were just basically doing a data audit.
Yeah. I mean, as you go through the PCF Knowledge Hub, one of the steps you will see during the data consolidation process is actually to do a data inventory of your data sources. This is critical, and this is something you'll see that it's going to help you map where you'll get data from.
Great, thank you. And then that was the last question that we had in the Q&A, but we do have a few more minutes if there's any last questions that anyone has. Oh, here's another one coming in hot. So Eric's asking, is data from the private sector gathered, given that that's not often reported at the national level?
Absolutely. Absolutely. So that is one of the tenets of the whole PCF. The idea is to be able to see where people are actually entering the health system, be it public sector, be it private sector, and be able to pick up the data. Which is why the data tool, the PCF dashboard, can also be used at the sub-national level, given that, as you rightly said, it's not typical that at the national level you're getting data for people in the private sector. You want to be able to aggregate that data up the health system. And so while you're using your dashboard at the sub-national level, you should be able to collect data for people entering the private sector and what is happening for people there. Are there diagnostic equipments? Are they getting treated? And then following the cascade of care for those people within the private sector.
I think one of the standard big questions with the private sector engagement is, what's in it for us? Because often the private sector is for profit and they need to make money, so they need to know why they're giving you data. And I found that a really helpful experience in this whole process with the workshops as well, where everybody is invited to really participate and understand what the data is used for. And as I said in one of the quotes that we had from one of the partners from the nutrition program, when people understand what the data is used for, then people are much more willing to provide information. If it means that they know that if they report into the system, they also can receive support and be part of the program, get some of the resources and be really integrated, people are much happier to provide information. If it makes a change to the health insurance payments, people are happy to provide information. So it's all about really getting everybody to understand what the data is used for, and that it's not just one of those users exercises that you have to tick the boxes and you have to send reports endlessly. It will actually, we believe, from the limited experience that we have so far, improve data gathering and people reporting to the system.
Great. And so then a more practical question we have here is when going to the website and going to the dashboard, it's asking about a username and password. How can our users get access to this?
I think Mike is already showing it, but right at the bottom of where you're asked to log in, you will see there's a demo username and password there.
The username is demo, and then the password is this PCF_2021.
Right.
So if you enter that in here, you should be able to get into the demo of the dashboard.
Great. And then Christina has another really good question here about considering the impact of COVID testing on TB lab services in many countries. Has the PCF team already thought about how we can link with those data? It might be managed in another database or instance of DHIS2 at the country level with TB as an add-on.
So I'm just going to talk a little bit about the work we did with countries. Like I said, we did a deep dive into existing TB data systems in 4 countries. And I think all 4 countries, as you rightly said, Christina, have TB, their TB laboratory systems totally separate, or the laboratory systems totally separate from the NTP, sometimes not even managed by the NTP. And I remember one of the countries was saying, oh, can we set up the system so you can integrate all of these systems outside HIS2 into one? And that is the ideal, that is the perfect, that is where we want to be. So we are already thinking about it. However, this will really depend on how a country wants to address their own systems integration as a whole. There's only so much an integration system can do when it is being managed by the country itself. And this is some of the development of a blueprint we can support countries to define and to help them build out when we understand their systems better. And we've done this with 4 countries to understand their systems better. So definitely, yes, it's something that we see that will impact the use of diagnostic equipment, especially in the time of COVID. And it will be good to be able to get that data into the PCF dashboard. I think for now, as long as a country is somehow feeding that data into the HMIS, the DHIS2 HMIS, it should land in the PCF dashboard. The problem will be where it does not link to the HMIS. Then we'll need to kind of think through how we can set up those integrations.
Great, thank you, Aguma. And thanks for that question, Christina. And I think that's why we certainly decided to use the DHIS2 platform, just because it's so widely used across so many countries.
Saying that there is obviously also a number of countries that are not using DHIS2 because they've got an alternative system or whatever. And I think I forgot to say that earlier. One of the things that we would like to do in the next phase as well is to write from the experience of the DHIS plugin a blueprint of what countries could do or build in their own system if they do not use a standardized health information system compatible with DHIS2. So we want to, give countries the options. So hopefully we will be able to inform that as well as a step-by-step sort of, this is what you need to keep in mind when you want to build a dashboard within your own system. I think we all will learn how the systems will integrate in whatever system is there. I think the key information for me is really or the key consideration is that TB needs to integrate into whatever is there as a health information system if TB wants to be integrated into health systems. And I think that's going to be the big challenge, because it's quite staggering to see what could be produced on information on COVID, because that was linked directly to the health system. I mean, stuff that we didn't think we could do in decades in TB was done for COVID when everybody felt the urge in a few months. So I think it would be good for us to sort of sail on the back of that wave and just really, get TB back into the game as well.
Yeah, great point, Kathy. And Mike, can I ask you to put into the chat as well that username and password? It is on that main screen when you try to log in, but perhaps just typing it into the chat as well will be helpful. And looking here, there aren't any additional questions. I think we certainly have a few minutes if you have any last questions, but also if not, we are available, and I will pass it on to Kathy to wrap us up if there are no more questions.
Thank you very much. Mike, could you just go back to the acknowledgement screen, please? Fantastic, thank you. Yeah, just again, a big thank you for everybody who was involved and anybody who has already expressed interest to be involved in the future. I think the future is bright for all of us, and I think we're going to really be able, if we work all together and put all our expertise and experiences on the table, we can really change the world. And I have been absolutely blown away by how much we have achieved, thanks to the very dedicated work of some crazy visionaries and some trusting countries who all work very, very hard in a tremendously difficult situation. I mean, who would have thought that we have to not just deal with all of the usual problems, but also COVID on top. And it hasn't derailed us. It has actually made us all stronger, I think. We learned a lot. We learned a different way of working together. It has opened the doors of being able to have a meeting like today with people from all over the world, all in one virtual little room. And I think if we keep that conversation going, keep ideas going, then this could be a fantastic way forward for all of us. On the screen, you'll see my email address. You can see, again, the link to the website. Check it out. There's also a contact us form on the website. We thrive on ideas. We thrive on suggestions and recommendations. This is just a very little part of the bigger strategic planning and programming thinking that we are discussing with the World Health Organization and with the Global Fund and all the other partners that you see on here. There's more to come. As we said earlier, the World Health Organization will publish the new NSP development guides, which are all very closely linked to what we have done. I mean, we're just a small part of it all. There will be new program review guidelines coming up and a lot of opportunities. There will be a new Global Fund funding application round coming our way fairly soon. This is part of a follow-up on the January meetings that we had, where many of you were part of, and this is built on your feedback then. We hope to have another follow-up meeting later this year when the WHO guidelines are out and the Global Fund has further guidance on where their strategy is leading. So watch the space, stay in touch, and stay safe. I think that's all for now. So we are ahead of time for once. We will put the recording on the website, so watch that space as well. And we will also have the slide deck there available for people to download and follow up. So thank you very much for your interest and hope to see you soon.